Guys, by popular demand, I'm going to talk about the myth busters about fillers done under the eyes. Because I hear a lot of trepidation from patients and friends when we talk about fillers under the eyes. And there's a lot of rumors out there about why fillers under the eyes is a bad thing or it's a dangerous thing to do. And I want to take you through all the different myths that are out there and prove to you how they are all baseless. Myth number one that I hear a lot, and that's your knee-jerk reaction, is fillers around the eyes is dangerous because it can cause blindness. I've been doing this for over 20 years, and we do fillers on a daily basis around the eyes, and that's just not the case. And the reason it's a myth is because anybody who's telling you that, whether it's a healthcare professional or not, they don't know anatomy. So if you know anatomy, and I'm going to show you anatomy, you will know that this is a complete myth when fillers are placed in the right plane around the eye. So let's come and look at anatomy. This is the anatomy of the eye. And so we place our fillers on the orbital rim. That's on the bone here. The bone is an avascular plane. What that means is that there is absolutely zero blood vessels that sit on the bone or the periosteum. It's an avascular plane. There's no blood vessels. So the blood vessels that you see here, these blood vessels are all in the muscle or in the fascia or over the muscle. On the bone, there's absolutely zero blood vessels. And the only way you can make somebody blind is if you inject a blood vessel that anastomoses and goes back to the retinal artery, and that's an artery that supplies the blood vessel of the eye. First point is that none of the blood vessels here actually anastomose with the retinal artery. They do not go back inside the orbit. There are superficial veins in the muscle and on the skin. So if you are in the right plane and you're injecting the filler under the muscle, there is zero blood vessels there. And besides, the blood vessels that actually go to the back of the eye or to the retina, that's called the retinal artery, those blood vessels sit on the lateral side of the nose. They're not in the orbital rim. It's this blood vessel called the dorsal nasal artery that can actually go back into the orbit, into the bone, and back into the retina. But those blood vessels are not here. So that's mythbuster number one. If fillers are placed on the bone, on the orbital rim, deep, which is where they're supposed to be, there is zero chance of blindness. That's a complete myth. So I want you guys to shed your fears of that myth. The number two thing that people talk about is, you can cause nerve damage if you put fillers under the eyes. But that's completely false also. Because again, if you know anatomy, and I'm going to explain that to you again, prove to you that's false. So the sensory nerve that comes out of our skull is the infraorbital nerve that comes out of the skull. This nerve, this foramen or this hole is much inferior. It's much lower than the area we put the filler under the eye. This sits on the cheek, the infraorbital foramen. So this is the only way you could potentially irritate the nerve ending that supplies sensation to around the eye. But we're never this low. We're much further superior, at least 1 or 2 centimeters above it. So that's virtually impossible. And these sensory nerves are, again, all in the muscle. They're not on the bone. The only time it comes close to the bone or out of the bone is in the infraorbital foramen, which is far, far lower than what we inject. Again, so this is not a possibility to cause nerve damage. And besides, even if your needle touches the infraorbital nerve, it just gives a zingy sensation, and you're not going to be able to damage a nerve via a very small needle, a 30 gauge needle. So that's completely false. A third thing that people talk about, if you put fillers around the eyes, it looks uneven. Well, certainly it can, and that's why you need to choose an experienced doctor so you don't get uneven results. Oftentimes when I see uneven filler done is when the injector or the doctor is too afraid to do deep injections and they stay superficial because simply they don't understand anatomy. And so you can cause lumpiness around the eyes, and that I've seen. I oftentimes am correcting these mistakes from other people that have been done. So we dissolve fillers when they're injected superficially because it looks lumpy. And an extension of that is that another myth out there is that it makes dark circles even darker. Well, the only way it can do that is if, again, you're injecting too superficially. Because there's something called the Tyndall effect, and that is when light hits the filler that's been injected too superficially under the skin, it gives a blue hue, a bluish hue. And that's the only way you're going to make a dark circle look darker if you're injecting in the wrong plane. When you're injecting deep on the bone, you're under the muscle. And you're not going to be able to see the filler under the muscle because we've got a layer of muscle, and the muscle is this thick muscle called the orbicularis oculi. And when it's under the muscle, the muscle is shielding the filler from being reflected by light. So that's a myth. If it's done in the proper plane, there is zero chance it's going to make your dark circles darker. It's the opposite. It makes dark circles better because it gets rid of shadowing. The shadowing comes from a hill and valley effect because there's a groove under the eye that is always shadowed because it's sitting, that groove is between the fat pads and is between the cheek. Finally, a last myth that I hear is, well, if you put fillers under the eyes, it can make you look like you have a slit for eye. That certainly can happen, but it's not from fillers under the eyes. We see that problem when people are overfilled, especially in the cheeks. So if you put too much filler in the cheeks plus the eyelids, you get an over puffy look, and that does push the lower eyelid higher, and it can make your eye look smaller. So again, that's not a common thing that we see. We only see it when the filler is done improperly. Too much filler is put in the cheek, and the cheeks and the eyes are overdone. It's not a very common issue. So to summarize, probably one of the safest areas you could put filler with amazing results is under the eye. And it just behooves you to find a doctor that knows anatomy and knows proper injection technique.